Dear students, welcome back. Now we are going to see the relationship between the cervical spine and its posture to the temporomandibular joint. Here, as we know that this temporomandibular joint formation, there are many bones are involved in the formation of temporomandibular joint. So, in that So behind the temporomandibular joint, you'll have the occiput, isn't it? And this occiput is articulating with the atlas and forming atlanto-occipital joint. Atlas is the first cervical vertebra in the cervical spine, isn't it? So like that, it is related with the toe of the cervical spine through structure. And now we will see how this relation, not only in the bony aspects but also some muscular attachments, also having some attachments with the top of these two areas, forming a biomechanical relationship. Now we will see that the cervical spine and the temporomandibular joint are intimately connected, and a biomechanical relationship exists between the position of the head, the cervical spine, and dentofacial structures. As we know that the temporomandibular joint is controlled by the primary muscles as well as secondary muscles, and these muscles are attached to the mandible, to the cranium, and also to the hyoid bone and the clavicle and the scapula. So all these muscles controls the movements of the temporomandibular joint, also having a relationship with the cervical spine because of its muscular attachments. Though the cervical spine is not directly attached to the temporomandibular joint, but because of all these muscular attachments, this shows that a strong evidence of the relationship between the temporomandibular joint and the cervical spine. Once the attachments of musculature are examined, if you examine these muscular attachments, the impact and also the impact of posture. So here you can see this is the normal posture of the neck, and this is protruded, that means forward head posture. Okay, the impact of posture on the temporomandibular joint is clearly visible or understood because of the attachments of the musculature. So once the tension in those muscles, the primary muscles and the secondary muscles, which has an effect on the position of the mandible. And also the posture of the head can also affect the position of the mandible. So how this forces, that is the tension which are created inside the muscles, and also the posture of the head will affect the position of the mandible. Now we will see. The correct posture minimizes the forces produced in the cervical spine extensors as well as the cervical muscles, which are necessary to support the weight of the head. Okay, so the correct posture minimizes the forces produced by the cervical spine extensors as well as the other cervical muscles necessary to support the weight of the head. If you see in the improper posture, so this is the improper posture, which are maintained for longer time, leads to adaptive shortening. So kontakalam, if you are maintaining this posture, so our body will adapt this posture. Our body will adapt this posture by shortening of some muscles and lengthening of some other muscles around the head, cervical spine, and the upper quarter. Upper quarter means the muscles which are attached above the scapula to the spine is called as upper quarter. So in these muscles there may be adaptive shortening or lengthening of the muscles can be seen. If you can see in this posture only, so up to you can see in the cervical posture what is happening here. So because the spine goes into extension, isn't it? In this posture the spine goes into extension. So because of this extension there is an adaptive shortening of the spine extensors, isn't it? And also on the anterior part this one is extended. So this one is lengthened. Okay, here some stretching occurs in the anterior cervical muscles. So that means such kind of posture is occurred due to improper posture. So improper posture which are maintained for longer time leads to adaptive shortening or lengthening of the muscles around the head, cervical spine, and upper quarter is happening. So what happens? So adaptive shortening is occurred or lengthening of the muscles occurred. So then what happened because of these two things? What is the result occurred in the TM joint? So because of this improper posture, there may be alteration in the range of motion. And there may be altered ability to produce muscular forces. So normal forces in the muscles are not obtained. There may be altered because of this improper posture. And also this improper posture which are maintained for longer time, which also causes some alteration inside the temporomandibular joint structure. Okay, so these are the things happen due to improper posture. Okay, if it is normal posture, the forces which are produced by the cervical spine extensors minimizes as well as the other muscles which are necessary to support the weight of the head. Okay, so many patients with temporomandibular joint dysfunction have concurrent cervical spine problems. That means if the patient coming with temporomandibular joint functions, simultaneously they will have some problems in the cervical spine. So with the intimate relationship of these two areas, any patient complains in one area, you have to examine not only this temporomandibular joint, you have to examine the other areas which are related to temporomandibular joint also. So if they are having temporomandibular joint pain, you have to check for the musculature, position of the muscles around the cervical and the head and also upper quadrant. If any problem in the cervical region will also having some pain in the temporomandibular joint. So both the things you have to examine. If any patient comes with temporomandibular joint dysfunction, you have to check out the other relationships with that of the temporomandibular joint. That means you have to check for the cervical spine and also upper quadrant and also the anterior cervical musculature, and you have to check the posture. Mainly the posture you have to check whether the head, the cervical spine are in normal posture or not. So you can't go for directly the TM joint structure or assessment. You have to take the cervical assessment also for temporomandibular joint dysfunction. Okay, now we can see one case here. A patient comes with a pain occurs concurrently in the head, neck, neck, and the jaw. The patient is having pain on all these three areas. So, what can be the possible things happen for this patient to get pain? So, a forward head posture leads to mechanical changes in the temporomandibular joint. A forward head posture leads to mechanical changes in the temporomandibular joint which stimulate nociceptors which are present in capsule, temporomandibular ligament and retrodiscal tissues which produces pain. Okay, a forward head posture leads to mechanical changes in temporomandibular joint, stimulate nociceptors. We know that these nociceptors are present in capsule, temporomandibular ligament and retrodiscal tissues which produce pain. To compensate this posture, there is an extension of the occiput. So there is an extension of occiput in the cervical spine. Okay, extension of the occiput and the cervical spine. So here, if it is extended in the occiput and the cervical spine, leading to compensatory flexion. So once here it is extended, as we know that this vertebral column is a closed kinematic chain. Any changes in any one of the areas or any one of the vertebrae, so will also causes changes in some other regions, isn't it? So like that. So here it is going extension to compensate this forward head posture. Here there is an extension in the occiput and the cervical spine, leading to compensatory flexion in the thoracic region or cervicothoracic junction. And also you can see some flexion in the upper thoracic region to achieve a level head position. So in this posture, so what you have seen here is there is an adaptive shortening in the cervical extensors and you will have simultaneous anterior cervical muscles lengthening. So is it a good thing? No, because here the forces which are the tension which are created in the muscles for a long time leads to some weakness, that is called stretch weakness in the anterior cervical muscles, whereas in the adaptive shortening also, due to over contraction of this cervical muscles leads to weakness on both the sides. And finally the structure in the cervical spine is affected. So what is happening? So as we know that, just go back to the muscle stress and strain curves. So what is the optimal stage of muscle contraction? That is, if the muscle length is maintained in optimal length, then it is having a very good contraction. Whether it is stretched more than the optimal length or it is shortened, which is less than the optimal length, we will not get better contraction of the muscles, isn't it? Yes. So such kind of things happening if there is an faulty posture. Then additional points related to this posture. Once the occiput is extended on the atlas, that is C1, which is creating adaptive shortening of the suboccipital tissues. That means the tissues, not only the muscular tissue, the other tissues which are giving support to that area is also undergo adaptive shortening. And also, so the structures or the suboccipital tissues include anterior atlantoaxial and atlanto-occipital ligaments, the posterior belly of the digastric muscles, and the stylohyoid muscles, the upper fibers of the trapezius, and also semispinalis capitis and splenius capitari muscles. All these muscles are going to adaptive shortening. Okay, so the forces necessary to maintain the head against gravity with faulty cervical posture and forward head result in muscle imbalances. So which leads to some problems in the temporomandibular joint. So such muscle alterations lessens the capacity of the particular structures to meet the thresholds for adaptive responses to physical stresses. So due to this imbalances, the forces which are created in all these muscles are not balanced properly. So this imbalance forces which are created in those muscles create what you call as it will not respond properly to the physical stresses. And this is about the relationship with the top of the temporomandibular joint and the cervical spine and the posture. And the important thing you have to remember that because of all these changes in the muscles due to faulty posture leads to what are the things happened if you have an improper posture? There is a decrease in range of motion, and also there is an alteration in the ability of producing this muscular forces, and also which leads to some changes in the joint structures. All these things creates some dysfunction in the temporomandibular joint. So any changes in the temporomandibular joint also shows some changes in the cervical spine. So both these are very much interrelated. So whenever if you want to investigate a pain in the temporomandibular joint, you have to investigate whether pain is present on the cervical muscles also. So some people who are having severe pain in the temporomandibular joint, on perception of these, on palpation of these cervical muscles, the patient will have some tenderness and also pain on those cervical muscles. You have to keep it in mind that you have to check out if there is any problems related to temporomandibular joint. You have to check other areas which are related to temporomandibular joint also. If any problem which are having around this thing, around this head and cervical region, and you also check for temporomandibular joint. So another important thing, if there is any shortening due to increased tension from the shortening of the suboccipital tissues, may also leads to headaches that originate in the suboccipital area, which limits the active range of motion of the upper cervical spine. Okay, that is called as cervical headaches. Such kind of headaches are called as cervical headaches. The patient complains some headaches behind the occiput over the head like this. The pain will appear at this thing. So because of there is an increased tension in the suboccipital tissues leads to headaches also. So for that you have to check out whether these tissues are tightened or relaxed. Like that you have to check out all these areas when you are going to treat any problems which are related to temporomandibular joint. So you have to check out all the structures which are related to the temporomandibular joint, that is head, neck and the upper quadrant. Okay, this is about the relationship of temporomandibular joint with that of the cervical spine and the posture. Thank you.